Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about early childhood caries. Let's start. So today I'm going to be talking about early childhood caries, a very important topic for your child and you as a parent if your child is up to 5 years of age or 71 months or younger. Now, what happens in early childhood caries, as the name suggests, it is early childhood caries. That means you contract the caries infection, your kid contracts the caries infection at a very early age, and this is usually seen around at the age of 3 or lesser than that and up to 5 years of age, and that's why we call it early childhood caries. It is also known as bottle fed tooth decay. It is also known as nursing bottle caries. It is known as bottle caries, so many other names. Basically, it has something to do with the fact that if you are giving your child a bottle feed, right, and a prolonged bottle feed without maintaining adequate oral hygiene, especially if it's a nocturnal bottle feed or even a breastfeed, it can lead to caries formation. Now, what happens in this case is that especially the primary first 4 incisors are involved concurrently, and the first molars as well. The lower incisors are actually spared because of the salivary action that the tongue pushes, and the salivary action takes care of the, it creates a lavage. So there is no, layer smeared of plaque and all those food debris or sugars on top of those teeth, and that's why the mandibular anteriors are actually spared. Now, you have to understand that we as adults, if we are undergoing any sort of pain because of dental issues, you can imagine that a child who is non-verbal at some point of time because of the age will be just very irritable and will be in a lot of pain and discomfort and won't be able to even express it as to what is happening. Now, this usually happens in 2 cases. One is that you have the child on a bottle feed and the child sleeps with the bottle. So if you leave the bottle with the pacifier into the child's mouth in the night so that the child falls asleep, it leads to a layer of the sugar and all those things, which is the food for bacteria to ferment and produce acid and decalcify the enamel that is present on the teeth. So you have to understand, for nocturnal breastfeeding also, and the fact that the bottle feed that is happening nocturnally, if you leave the bottle with the child while he or she is sleeping, or you're doing nocturnal breastfeeding, the salivary action of the saliva is secretory action is reduced in the night. That's where the caries action can become more enhanced. On top of that, you have to understand that there is some sort of a vertical transmission also from the mother or the caregiver. It could be a parent, right? Someone who is in close intimate contact with the child because of hand gestures, or the child touching the mouth of the mother, or even just gestures like kissing the children on the lips. So that can cause the transmission of the bacteria from the mother or the caregiver to the child. So you have to be very careful regarding that. Also, the oral hygiene of the mother has to be impeccable so that the kind of transmission is minimized. Now, there are some risk factors for ECCs, that is early childhood caries. The first one obviously is poor oral hygiene. That means the child's oral hygiene is not being maintained. That could be because of lack of education or lack of awareness about oral hygiene. And secondly, it is stuff like snacking between meals, taking a lot of high sugar diets, using milk formulas, and at the same time nocturnal breastfeeding or bottle feeding for a very prolonged period of time till the child falls asleep. So you have to be very careful about these things, because the child will undergo the lesions start as white spots and then go to the frank cavitation, and this can cause a lot of grave concern for the child's mental state, because it can cause emotional distress in the form of pain. Secondly, children who are younger or who are much smaller than 3 years of age, you have to understand that they're not very cooperative when it comes to dental treatment. And also there is something known as a DMFT score. That is the criteria for ECC, that means decayed, missing and filled teeth. There's a score, particular score. If the child, for whatever age, meets that criteria of the DMFT score for that age, definitely it could be a diagnosis of ECC, and if it is much severe, it is known as severe ECC, that is severe early childhood caries. So you have to understand the gravity of the situation, that because of this active infection in the mouth, the growth rate of the child can be retarded. The child can refuse to gain weight and not be healthy. On top of that, there is a mechanism that has been proposed that because of the fact that the child is in so much discomfort, he or she ends up breaking the sleep cycle. That increases the cortisol, which in turn helps in increasing the interleukin 1 levels, which is a chemical mediator. And that's why, because of that, it can lead to ineffective or reduced erythropoiesis, that is the formation of red blood cells. That means the child could become in the long run anemic. You have to understand the implications of this. There are other risk factors also involved, such as neglect or poor socioeconomic status. On top of that, areas where water fluoridation has not been done properly, and there is lack of oral health care in terms of fluoridated toothpaste, and the fact that there is a lack of knowledge and education about oral hygiene practices. You have to understand that these things can be taken care of at a very basic level. All you have to do as a parent is take your child to the pediatric dentist, and also take them to the pediatrician so that they can have a look at them and refer it to a pediatric dentist, because of the fact that you can stop these things in their tracks. Thanks to water fluoridation programs, these things have reduced at the end of the 19th century. But then again, there are still some areas in the developing countries where there is still some problems happening regarding this. Coming to the more serious aspects about it, you have to understand that for children with special healthcare needs, these kind of infections that are there because of ECC can lead to very major complications, especially around bone marrow and organ transplants and other things, and it can literally cause infected heart valves which are damaged, which can lead to a lot of morbidity and mortality as well in some of the cases. What can you do as a parent? I'll have to be very honest. Please make sure that by the months of 12 and 14 months of age, make sure that the child is weaned off the bottle. You're not giving them nocturnal breastfeed as much as possible. Try to give them, wean them off from that. On top of that, avoid snacking and sugary things for the children, no matter how much they ask for it between the meals. Make sure you are doing that with the meals so that there's a cleansing action of the saliva with the chewing. And you have to understand that you have to ultimately go, if there is already diagnosed ECC, you have to go to a pediatric dentist and get the restorative treatment done for the children. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's causing you discomfort. I'll reply to you within a couple of days. Please be patient. And if you have any queries, doubts, and apprehensions and insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.